All right, Mr. Gowan, we're now gonna do an assessment of your abdomen. And I just am starting by examining how it looks, and I'm seeing that your abdomen is round and even. It's the same color. We say it's homogeneous in color, kind of pink. I don't see any signs of jaundice or any swelling or masses. So this should be symmetric bilaterally. And I could stand at the end. I'm leaning over, but I could stand at the end of the table and look up and see that you don't have any irregularities. And I would like you to take a big deep breath for me and hold it for just a second. Okay, you can release it. So I don't see any kind of bulges or masses. It continue to stay smooth and symmetric. And your umbilicus is midline. It's inverted, which is the more common way. And there's no signs of discoloration. There's no inflammation. There's no hernia that I can see in this area. And if I look carefully at your chest, sometimes you can visually see the pulsation of the aorta, and it would be in the epigastric region, in this upper region, and that would be normal. And sometimes I'm seeing respiratory movement, and that's common and normal as well. Occasionally you can see some waves of peristalsis for some people, and that also can be considered normal. So we always start with the visual inspection first, and then the next thing we're going to do is we're going to auscultate, or I'm going to use my stethoscope to listen to sounds in your abdomen. And we start with auscultation because the next thing I will do is palpate and percuss your abdomen, and that can generate bowel sounds. And so I don't want to do that before I listen to what the normal sounds is, because that could skew what the normal is. And I did fail to mention, you have some nevi here, and this is normal, these small pigment changes, but you do not have any lesions or any rashes that I'm seeing, or any other abnormal marks or moles. All right, so auscultation, as I said, is before percussion and the palpation, and this is where I'm going to be listening for some bowel sounds. And bowel sounds are when you're in a supine position, particularly, the gas rises in the intestinal area, or to the upper part of the body, and so that's when it's easiest to hear it. And I'm going to make sure that I only put my stethoscope on lightly, because if I push too hard, I can generate more activity in the bowels. And we always start in this right lower quadrant. This is the ileocecal valve, and we are there because there's always bowel sounds there. If you have bowel sounds, they're going to range from 5 to 30 gurgling type sounds in about a minute. That's considered normal. And if you have more than that, it would be considered hyperactive. And if you don't have any bowel sounds, I would have to listen to this area for a full 5 minutes. And if I did not hear any bowel sounds at all, then I would say that you had no bowel sounds or absence of bowel sounds, and that would be a medical emergency. So we would want to be able to know that right away. But when your stomach is growling, the fancy word for that is borborygmus. I'm not sure if I'm pronouncing it correctly, but we even have a word for that. So I'm going to start by checking all 4 of your quadrants for bowel sounds. Actually, I'm hearing gurgling just fine. And I would listen for 1 minute. And they seem normal and not hyperactive. I can hear some here, but not as many. Quite faint in this region, but I can certainly hear them here as well. And that also can be affected by how recently you've had a meal. All right, Mr. Gowan, the next thing I'm going to be doing is I'm going to be listening for vascular sounds. So there's some arteries and veins. The first one up in this upper region is the aorta, and then on either side you have a renal artery, and then you have the iliac artery, and then down in the lower area here of your abdomen is the start of the femoral artery. So I do have to put a little bit more pressure with my stethoscope to listen for those, and I'm trying to see if there's any bruit. That would be considered a concern, and we do have to remember that that can actually still be a normal finding in somewhere between 4 and 20% of the population. I'm going to. This is the. I'm not hearing anything. Hearing bowel sounds, and now I'm listening to the aorta. Can hear it. This should be systole. It's kind of a low pitch, and it's between the xiphoid and the umbilicus. But I certainly can hear it here very well. Okay. Actually, I can hear a sound on this side as well. Your bowel sounds were more loud on the other side. It was harder to hear. Okay. I'll try one more time over here. No. That's not a concern because I'm not hearing bruit. But okay, so now I'm done with my auscultation. The next section is tympany, so I'm going to be tapping at various points on your abdomen, and I move in a clockwise position, and tympany is what I will hear mostly, but then if there's an organ, I'm going to hear some dullness, so, or a mass. So I'm going to start here. Oh, tympany. Is it tickle? Sorry. Okay, so now I'm hearing a little dullness. So I'm getting into the region of the liver. Sorry that you're laughing. Okay, so I heard this dullness in this area over here. Now also in your lower abdomen, if you had a distended bladder, I could also hear some dullness. All right, Mr. Gowan, the next thing we're going to work on is your liver span. And so to do that, I'm going to do a little bit of percussing again, and I'm going to identify where the sound changes, and I'm going to put a small mark on your chest here, and it will wash off, and then we'll put a second mark, and we're going to measure the space. So I'm going to start again. Okay, so kind of between the about the 5th intercostal space is where I'm starting to hear some dullness. Okay, so I'm going to make a small mark, and then I am going to continue up. Okay. And then using my tool here of a ruler, the normal measurement is about 6 centimeters. And actually, I have a little bit more than that, but I would say that it's a possibility that there's that kind of a variation. And I'm also going to do some palpating in just a minute. So, okay. Okay. So I'm starting to, the dullness is stops about over here at the midline, which I would expect, and then this is where I would get about the 12 centimeters, and that would match up with the expected findings, so that is terrific. Next, I'm going to be trying to identify if you have some splenic dullness, and this is not always easy to hear. Okay, and I don't think I'm able to hear that. It's yeah, it should be at about the 9th to 11th intercostal space behind the midline, and I'm well. Okay, so now I'm over at the 11th intercostal space, and I am hearing tympany again, and so if you can take a deep breath, by the way, take a big deep breath. I still have tympany, and that's the normal finding for that as well. Okay, so I'm going to have you sit up for just a minute. Okay, so we're looking at the costovertebral angle tenderness, and I'm trying to feel for kidney placement here. And again, I'm going to actually lay my hand on it. And okay, so I'm going to put my hand on here. And I'm checking for your kidneys. And do you have any pain? So you feel a thud?
Yeah.
Do you feel any pain?
No.
Okay, that's fine. Thank you. All right, Mr. Gauen, I'm going to do some light palpations. And this is, I'm not actually trying to feel like all your organs, but I'm just trying to see if there's anything that's tender. But your abdomen is soft, which is just the way it's supposed to be. I'm worried about you being ticklish. So my overall impression of your abdomen is that there's no rigidity and there's no masses, there's no tenderness, and you're not guarding at all. You're not protecting, like responding in pain. Now the next section is the deep palpations, and so I am going to go in the same area. I'm going to use my fingertips this time, and I am going to kind of feel deeper in the abdomen. I can actually use the hooks method and feel the base. Take a big deep breath for me. Breathe in, breathe out, press out. Okay, so now I can kind of feel the margins of the liver when you do that. And that's the hooks method, and that's just one of the methods that would allow me to feel. But you've got no, again, assessing your abdomen, I'm finding the normal expectations of a soft abdomen with no guarding or any tenderness that you're having. If I needed to evaluate you for ascites, that is if you have fluid in your abdomen, and I'm going to ask you to put your hand in your midline right here, like this, on your side, like this.
Oh, like this?
But you're going to bend your wrist.
Oh, okay.
And then I am going to kind of push this side,
Yeah.
and I'm looking to see if there's a ripple that goes across, and there is none. So I am not seeing that you have any ascites. There's no fluid wave. That's called a fluid wave test. A second test for ascites is something called shifting dullness. And this is when, because of gravity, when you're supine, the fluid will come over to the sides. And so, again, I would do some tympany and see if I could notice that there is a change in the sound, and that will tell me when it becomes dull that that's where fluid is in that spot. All right. A second way that I can feel for the liver is I'm going to press here in a deep feel, and I can feel the edges of the liver, but I also can do it with the hooks method as previously demonstrated. And now I want to try to palpate the spleen, and this typically is not something that is something you'd feel. The spleen would have to be 3 times its normal size, and you would feel it between the 11th and 12th rib, and I am not sensing it here at all. Another thing would be for you to kind of turn towards your side a little bit. Can you roll? Yep. And again, I'm not feeling that. And it can be covered a little bit by the stomach can be in the way. Next, for kidneys, I'm going to use my hands like a duckbill and feel for the kidneys. And then on this side, a little bit different approach. All right, and then using my thumb and first finger, I'm going to press in and feel for the aorta. And I am not actually feeling anything there, but normally it's 2.5 to 4 centimeters wide in adults, and it pulsates in the anterior direction, but I was not able to feel that. Let me try again. No, I'm not.
My belly's too big.
Well, now if you came here because you were having some other symptoms, I would be able to evaluate you for something called rebound tenderness. And this is when you have abdominal pain, or even like when I was palpating your abdomen. But if I have somewhere where when I put pressure on it, you don't feel pain, but when I remove my hands, you do feel pain, then that's what we call rebound tenderness. And this is when you have the peritoneum is inflamed, and a lot of times we use this as a way to evaluate for if you have appendicitis. So I'm going to press in this general area here, and then I would lift my hand up, and if you had pain, you would tell me, but you don't have an appendix, so
Right.
it's not going to work for you. And then there's something called Murphy's sign, and normally when you palpate the liver, there's no pain, but if someone has inflammation, particularly of the gallbladder, they can have pain. And so again, you're going to identify the border of the liver, and when you're in supine, I'm going to ask you to take a deep breath, and then, well, I have to palpate your liver first. Okay, so I'm going to feel under here, the border of the liver, and I want you to take a deep breath. And the normal response with you is you can exhale. And do you have any pain?
No.
Okay, so if you did, that could be symptomatic of a problem with the gallbladder. And then there's the iliopsis muscle test, and this is done when you, again, also could be experiencing appendicitis. And so with this example, you're in the supine position, and you're going to lift this right leg straight up at the hip, this leg, right leg, just straight. Keep it straight, please. Whoops. Okay. And then I'm going to push down on the lower part of the thigh while you're trying to push up on the leg. And do you feel any pain?
No.
Okay, so you can put your leg down. But if you did, then that could indicate that you were having problems with your appendix. One final note is that I wanted to comment that there was no CVA tenderness. And so that was a good finding and normal.